when the December 1 floods affected this, it was a much larger flooding that had happened across the city in Chennai as well as a lot of villages. The scale of the disaster was so large. We've been now working in about 120 villages and about 70 places in Chennai. So that is the kind of disaster. The scale of the disaster was really unprecedented. We had not expected that to have happened at all within Chennai. Everywhere, people had lost so much that it was very heart-wrenching to kind of work with them and see the amount of suffering that they had gone through. One really terrible thing that has happened through this is a huge number of families, particularly the poorest sections, they have lost their huts. They already lived in a very tiny hut. You're talking about 150, 200 square feet place, very small place in which they were living. But even that hut had completely got destroyed. And many of these people who lived in these huts were from the poorest sections, where they are not going to get back, rebuild their houses on their own. I'm very happy to say that the first few huts into homes we have been able to complete, and we are hoping that by this month end we would have done about 20 of these. Through the entire program, we should be able to do about 500 huts at least if we are able to get the money raised for this work. The first month, almost I would say, was devoted towards immediate relief. And even as people were going back, what we wanted to do was to provide them with relief packets that will help them sustain for about 10-15 days. Packets with potatoes, with onions, things like that to get them started. So dal, rice, oil and some basic vegetables. Parallelly, we started looking at health. The number of mosquitoes increased tremendously. So we were also looking at mosquito prevention. We had our volunteers going and doing fumigation in many places. We gave people a lot of mosquito repellents. And apart from that, looking at health camps. We provided a lot of water filters to many of the villages. Now, the phase that we are currently into is the long-term rehabilitation phase. Apart from contributing individually, a lot of people can come together and make a much bigger impact. So when we had this discussion with Bob, the idea that we will be able to adopt an entire village and make a bigger impact, not just in terms of converting huts into homes, we will also be able to construct a community level education center, a health center. We'll also be able to look at health and sanitation and providing water supply to the entire community, and looking at continuous education program where we can provide inputs to improve quality. I'm very grateful and thanks a lot for Iitmaana's wonderful support. I would like people from IIT Alumni Association and a lot of alumni to contribute towards this effort, and I'm sure that people will be able to visit it. Many of you, when you come here, please do come and visit the efforts, because apart from the monetary contribution, getting engaged, looking at the programs directly, and when we do this jointly, we should be able to make a very large impact. So thank you once again for partnering with AID and for working with us jointly. I'm sure that this will be able to demonstrate a very large successful model, and thank you once again for participating in this program together.